All right, welcome back for another Doc Talks, and today our topic is hurt versus harm. I want to take a second just to describe this. So hurt versus harm, what we feel is hurt, and then harm is actually the tissue damage that's actually at the body. These things don't always correlate very well with what we experience as a human when we're dealing with pain. So we want to make sure that you understand what the difference between hurt versus harm is, and then how you can perceive that sometimes as different. So our first topic is, why can it hurt a lot and not be significantly damaged?
Yeah, so I mean, you can experience pain through really any activity in life. It would be something, and you can think about how much a paper cut hurts, but the damage is very, very minimal. Right, so you have different areas of your body that have different sensitivity levels.
Huge.
And then too, that kind of acute ouch, I just hurt myself, it doesn't always lead to like a physiological damaged tissue injury. You could bump your arm against something and ouch, that hurts, because your brain is going to tell you, ouch, that hurts, don't do that again. But hey, I haven't actually hurt anything, because your brain, everything is done by your nervous system, and everything you touch, feel is experienced by those nerves, and your brain is just going to be getting that signaling of ouch, that hurts, don't do that again. But hey, I didn't necessarily hurt myself in terms of cause damage to my tissues, just temporary pain. It all depends we talk about severity, when that is something that's been damaged and then needs assistance in healing.
Yeah, so when she says you hit your hand and that actually causes a lot of pain when there's truly not a lot of damage there, that might be because maybe in the past you've done the same thing, except you really whacked it, and your brain is remembering, oh man, every time I hit my wrist, that's going to be really painful, danger, was.
Yeah.
So our brain has this funky way of remembering pain and remembering occurrences. So that's definitely something that we got to consider here. And when I'm dealing with someone with maybe a reoccurring pain or something that they've had in the past, and they compare it to that, I always try to tell them, hey, take a step back and see if the mechanism of injury is more or less, or you feel like the tissue damage is more or less, and just take a step back and really feel what it is that you're feeling, and don't just assume that it's going to be a lot of pain. Pain is actually processed a lot in the brain. We just get all these signals, like Dr. Kelsey was saying. If we just get all these signals and it's just a flood to the brain as fast as possible, sometimes the brain can't process it fast enough, and it'll just shoot out a bunch of pain and say, save yourself, protect yourself. So that's when you can have this small amount of damage and a massive amount of pain. And then next, why can you not have a lot of pain when there is significant damage? This is a big one. So say you're walking through the woods and you step and you break your ankle, but at the very same time you see a bear and it's about to come and eat you. What do you think your brain is going to tell you? You better get the heck out of there so you can save yourself. So you're not going to feel that pain at your ankle. You're going to run, and it's just going to be flopping right next to you, and you're not going to feel it until you actually have the time to process that pain.
Mm-hmm.
So the tissue damage isn't always going to be felt if it's not the priority that needs to be felt at that point. Your brain will organize it, and we are very intelligent bodies, to tell you, hey, you need to save yourself and not feel that pain right now, so run. So that's very important that you understand those things.
The adrenaline, so in a lot of sports, you'll see people continuing to play, and it won't be until they come off, stop playing, or even, there that night where it's like, holy smoke, something is wrong with this area, and it's because, your brain is prioritizing something else. Your brain, is triaging you without you knowing it. And again, even just that adrenaline rush that gets pumped through your body too, in more of a crisis situation, right? Like if you're being chased by a bear, it's, hey, I gotta save my life, and not, hey, I got to, limp on one leg to not hurt this anymore. So sports is very common where we see hey, you can have a debilitating injury right away, but a lot of times too, people play through a lot of injuries and then really see the severity of it afterwards, just because, again, they were focusing on a different activity, brain was focused on elsewhere, and they just didn't realize it. So pain definitely goes both ways, certainly, by all means. And then common things that we see too is when people get imaging done, especially when we talk about things such as x-rays or MRIs, we like to tell people and hear what's going on first before we order those, because images don't always correlate to what you are feeling in the body. We have people that will get images and there might be disc bulges or disc herniations shown in them, but they're not experiencing any pain or any symptoms that might be associated with that injury. So a lot of times we see that too, and even in x-ray images of the spine and other areas, we might say like, ooh, this should be causing symptoms and pain, but they might not be having that experience too. So it goes to show that, hey, you really gotta talk to a person first, say, hey, what are you feeling? What are you experiencing? Talk about it, and a lot of times we say like, hey, that image does not define you, what you're feeling, and vice versa.
That's huge for patients to be able to hear that, because a lot of people are given a diagnosis from a medical practitioner, and if they hold on to that forever, then they're going to always think that they're limited, they're broken, and it's just not true. There's a lot of times when we can heal from those images and those diagnoses, and the medical image doesn't always tell you what you're going to have for the rest of your life, and it also doesn't always correlate to pain, like she said. So if you've been trapped by some pain, or you feel like you don't really understand your pain, we'd love to take a couple of minutes to talk with you about that. If we want to get some treatment on certain pains that you don't feel like you're overcoming quite fast enough, reach out to us at 702-558-2151, and we can get that checked out for you. Thanks, guys.